TCAT McMinnville, the PN program, we have a comprehensive theoretical and clinical component. It is a 12-month program based on hours. We also have a hybrid program that is also online. The students will come in and have practice in lab and practice different skills. Each student will get some more individualized care. What we like about that is that the classes, they're large, but they're not so large to where they would not get the individualized care that they need. We always have an open door policy, so any students that need that special education or any type of tutoring, we could always help them out as well. As far as getting into the program, Tennessee Promise does participate in that, and so our enrollment is up because of that. And all the students have to do is take 2 prerequisites, which is a dosage calculations prereq as well as a anatomy and physiology prerequisite. And once they get those completed with a passing grade, they can go ahead and start the program. Again, we have tons of funding between FAFSA and grants and so forth, so students have a lot of options to them as far as getting their education and paying minimally out of pocket. So in our laboratory, what we do in here is practice basic nursing skills. This is done in their first trimester under the course of fundamentals, and they will learn things like bed baths, basic care, how to feed a patient, how to put in a Foley catheter, how to do trach care, how to put in an NG tube. So all the basic nursing skills, as well as even CPR and things like that. We also do IV therapy in here, as well as phlebotomy. So they spend a lot of their time in their first 6 to 8 weeks in this laboratory practicing basic nursing skills, so they get very comfortable before we start clinical rotation. Okay, where we're at right now is the simulation lab, and what that is a computerized lab to where the students will come in and be given a scenario on a computer in which an instructor will sit behind them and basically give changes in vital signs and so forth. That student will go ahead and work on the mannequin, and basically that student should be able to implement the correct procedures and so forth according to what they see on the simulation computer. So that's one of our things that we do that would kind of simulate a real patient scenario for them when they're out in the field. So this is their simulation lab. We also do IV lab draws. We do, what else? They put in catheters. We have newborn assessments here. So a lot of this is overseen by our SIMS coordinator, and that is Julie Young, and she basically runs our simulation lab. We do count that as a clinical day, and so the students really benefit from that to get that practice.